Marcus.
Hi.
Allie again. I'm here to do your head, ears, nose, and throat examination for you today, an assessment. Is that okay?
It's okay.
Okay. We're going to start by looking at the head and neck, and then move down the systems through there.
Okay.
Starting with visual inspection, looking at the swollen head to see that it is upright in midline. I don't see any involuntary tremors or muscular movements. No obvious deformities or depressions noted in the skull. The skin is appropriate for a brace and appears to be well nourished. I do see that the hair on the head and facial hair is both groomed and clean and well kept. Looking at the rest of the face, I do note that you have diffuse freckles throughout. Moving into palpation to check for any tenderness, lumps, or swelling.
No, it's fine.
Of the face and head. Palpating the hair is smooth and fine. I don't feel any obvious coarseness anywhere. There's no significant hair loss. It is not brittle. The scalp does not have any crusting or flakiness to it. It is intact. The skin across the scalp and face feels of appropriate temperature and of appropriate moisture. When we look at the hair, we look at the nails as well. So I'm going to look at both of your fingernails. Looking across and inspecting first, noting length. The fingernails are groomed and managed and clean. Palpating of the fingernails, they are hard and firm and smooth. I don't see any kind of abnormalities, lesions, nodules, any pain upon palpating any of your fingers?
No.
Okay. Checking for clubbing, I'm going to have you put both of your thumbs together here. Clubbing is not evident. We're going to move down to the neck next. Again, beginning with inspection, looking for symmetry, making sure that both sides look equal. Noticing that the trachea is midline. I don't notice any kind of lesions or masses as well. You do have some more freckles throughout the head, neck and upper chest. We're going to assess for range of motion of the neck first. I'm going to have you turn your face to the right and then to the left. Go ahead and tilt the head back and chin to chest. Very good. I'm going to do right ear to your right shoulder and then again on the left side. Any tenderness or pain when you do any of that?
No.
Okay, so you have full range of motion of the neck. We're going to go ahead and move to palpation next, checking the color and temperature of the skin, noting any lumps, bumps, or discomfort, any tenderness anywhere?
No.
No. Okay, very good. We're going to look at the lymph node chains next, making sure that none of the lymph nodes are enlarged, tender, or fixated. Beginning with the pre-auricle and then post-auricle. Any tenderness here?
No.
And post behind the ears?
Mm-hmm.
Okay. Occipital?
No.
Okay. Tonsillary?
No.
And submandibular?
No.
Submantle underneath the chin?
Mm-hmm.
Okay. We're going to look at the anterior and posterior cervical.
No.
Any pain here?
Mm-hmm.
All right, the sternocleidomastoid next. And then the deep cervical, which can't really be felt, but if they were enlarged would be here. And again on this side. And last, we'll palpate the supra and infraclavicular lymph nodes. Any tenderness here?
No.
Any tenderness here?
Mm-hmm.
No. Okay. Moving on to the thyroid. Going to locate the cricoid cartilage first, and then beneath the isthmus we'll feel the thyroid gland, notating its size and confrontation. I don't feel any nodules or abnormalities here. Any tenderness?
No.
Okay. Go ahead and give me a swallow. All right. I do feel a nice smooth movement of the thyroid gland upon swallowing. All feels normal. We're going to go ahead and do an auscultation of the thyroid next. Checking for any bruise. Okay, which none are present. And moving back up to the head, we're going to just palpate in the temporal arteries for pulse, which feel okay. And then the temporal mandibular joint, go ahead and open and close your jaw. One more. Any tenderness there?
No.
No, okay. Auscultating the temporal pulse. Okay, no presence of bruit bilaterally. Next, we're going to move to the eyes, beginning with inspection, looking at the orbital areas, making sure that there is no swelling or obvious drainage, looking at the orientation of the eyebrows and the eyelashes, just noting the growth. Everything looks regular and not abnormal to me. Looking at the eyelids to note for any redness or swelling, any flakiness or drooping, which I do not see present. Moving to the inner eye, the sclera are both white bilaterally. There's no yellowing or jaundice apparent. Pulling down on the lower eyelids to visualize the lacrimal duct. You don't see any kind of swelling there, and both of the conjunctiva are pink and not pale. There's no discharge or any foreign objects noted. Palpating the rest of the orbital area for any swelling, lumps, or tenderness. Any tenderness while I'm touching? No. Okay. We're going to move on to the pen light. I'm going to use a light to shine in both of your eyes just to look at your irises and your cornea and check your corneal light reflex. You can just gaze over my shoulder for me here, okay? Sorry, it's bright. Okay. Looking at both of the corneas, they are clear. There are no opacities or any kind of cloudiness present. I am able to see both irises that have a similar visible pattern, similar in color bilaterally. We can see a presence of the corneal light reflex. Both of the pupils are about 3 millimeters, round, brisk, and reactive to light, both direct and consensual light. We can see that visualized with shining the light in the left eye for the first time. We can see constriction of that left pupil, and then the second time, again, constriction of the right, and vice versa. Moving on to visual field testing, using the confrontation test, I'm going to wiggle my fingers, and you tell me when you can see them, okay?
No. No. No.
Okay, very good. So we have peripheral vision that is intact in the nasal, superior and inferior views. We're going to auscultate both of the eyes for the presence of bruit. Close both your eyes for me. Okay. Which I hear none. Moving on, we're going to look at the extraocular muscles and check the 6 cardinal views, looking for full coordination, making sure there is no nystagmus. I'm going to have you take a look at my finger. Follow midline, up and down, at the center, midline, over, up and down, and back to center. Okay, very good. Everything looks good. I don't see any kind of nystagmus there. Next, we're going to check for convergence and accommodation. I'm going to have you look at my finger again and move it closer to your nose. We can see that the eyes are following to about 5 to 15 centimeters from the face. Also, the pupils are constricting as my finger moves closer to your face. So both look good. We're going to do visual acuity next. So we can have you step back. He's standing at 20 feet from our Snellen chart. I'm going to have you use your cue card to hold over your right eye and read first with your left eye for me, this line here.
DEFPOTEC.
Okay, and then switch the card over to the left.
DEFPOTEC.
Perfect. You can come have a seat for me. We're going to move to the ophthalmic inspection next. Checking your lens, looking into the inner eye. I'm going to cut the lights down. Okay, and we are going to look into the back of the eye, locate the red reflex, look at the blood vessels, Look at the retinal color, which should be a pink hue. Visualize the optic disc, and then look at the macula densa. Okay, so I'm gonna start with your left eye. You can go ahead and just look over. You see the light reflex here. Okay, you can see the optic disc and the vessels of the eye. I don't see any kind of hemorrhaging or nicking present. The disc is yellow with well-defined margins. Again, moving over to the right. Okay, reflex. And again, looking at the vessels, no obvious hemorrhaging or anything, and optic disc. Okay, everything looks good. We're going to do the macula densa next. This one I'm going to have you look directly at the light just momentarily, so we can visualize it. Will be yellow, surrounded by a deep pink. Okay, you ready? Just looking straight in. Okay, and then again on this side, looking straight into the light. Reflex. Okay. All right, very good. Turn the light back on, so we can move on to the ears. All right, beginning with inspection of the ears, we're going to look at the symmetry, color, and placement. No visualized deformities, abnormalities. I don't see any kind of discharge or lesions present. Upon palpating the ears, do you feel any tenderness?
No.
There are no nodules or anything noted here as well. Performing a tug test on each side to check for signs of inflammation or infection. Does this hurt at all?
No.
Any pain? How about on this side?
No.
No. Okay. Looking at the mastoid area behind the ears, both are free of any depressions or deformalities as well. Okay. We're going to perform a whisper test. I'm going to occlude the tragus and whisper a word for you. I want you to tell me it.
Apple.
Okay.
Apple.
Okay. Can pass in here with the whisper test. Using our tuning fork to do the Weber test. I'm going to place this on the top of your skull. Can you hear that vibration?
Yeah.
Does you hear the same in both ears?
Yeah.
Okay. And the Ryan test. I'm going to place this on the mastoid process. Do you hear the vibration?
Yeah.
Tell me when you stop hearing the vibration.
No.
Do you hear it now?
Yeah.
Okay. And on the right. And the mastoid process. Do you hear it?
Yeah.
Tell me when you stop.
No.
And do you hear it now?
Yeah.
Okay, very good. Last, switching over to our otoscope to look into the auditory canal and visualize the tympanic membrane. We're going to be looking at the umbo handle of the malleus and light reflex. Okay. For adults, we're going to pull up and back. And I'm going to look, just slightly insert the tip into the auditory canal. Visualize the tympanic membrane, which is pearly white in color. The light reflex. Okay. And on the right side, again, up and back. Inserting the tip. There is a slight presence of earwax. And again, visualizing the tympanic membrane. Okay. Next, we're going to move on to the nose, beginning with the inspection of the external nose, noting size, shape, and color. I see the nose looks symmetrical. There's no lesions or discharge coming from either of the nares. We're going to palpate for any tenderness.
No.
No nodules, no presence of displacement of the bone or cartilage. Patency of the nares, I don't hear you breathing. You have noiseless breathing, so they do appear to be working in open and patent. Utilizing our otoscope, we're going to take a look inside each of the nares to look for any kind of polyps, discharge, any swelling of turbines, or perforations in the mucosa. Have you just tilt your head back just slightly? Okay. All right. I don't see any perforations or swelling here. And again. No deviated septum either. Last, we're gonna look at the throat, beginning with inspection of the external mouth, looking at the lips, making sure that they're free of any kind of sores, cracking, or lesions. The lips do appear pink and don't look swollen to me. We're gonna go ahead and put my gloves on for the rest of this. When you open up the mouth, I'm gonna take a look at your teeth and gums first. Go ahead and say "ah" for me. The teeth all appear intact. They are not loose. I don't see any obvious dental caries. The gums are pink. There's no bleeding or swelling noted. Do you have any pain or discomfort anywhere in your mouth today?
No.
No. Okay. Looking at the tongue next. Go ahead and tilt your head back just a little bit so your tongue way up. The tongue is pink, dark pink. There's no lesions noting and no crusting at all. The tongue and uvula do appear midline. I don't see any kind of ulcerations or striations either. Go ahead and we're going to palpate the tongue as well. Palpating the gums, I don't feel any nodules or swelling, any tenderness when I'm touching it all? No. Okay. And last, we're going to just elicit a gag reflex to make sure that it is present. I'm going to have you say "ah," visualize the back of the throat. I didn't do it yet. I'm scared.
Yeah.
Okay, just take it out. I'm just looking right now. I'll tell you when. Don't see any kind of swelling or abnormalities here. The back of the throat is moist and pink. And we're going to go ahead and reach back for your gag reflex, and it's present. You passed. Okay, thank you so much.
Thanks.